Good morning, everybody. Hello, hello, hello. Good morning. Morning on this beautiful day here in downtown Norfolk, Virginia. It is so wonderful to see you all this morning. My name is Maria Elena Valores. Welcome to the American Diabetes Association's annual Executive Wellness Breakfast. Like I said, my name is Maria Elena. I'm the evening anchor at Wavy TV 10 and Fox 43. I'm so excited to be with you all today. Thank you all for coming out here today. In recognition of American Diabetes Month, we're going to kick off today's program with a video which highlights the association's mission and purpose.
We've all loved, lived with, and learned from someone with diabetes. It has connected us, usually without us even noticing. So it's no secret that we all want a cure. But the thing we want even more is life. Life and everything it can be for this generation and the ones after us. So we focus, work, innovate, and advocate because there's nothing we can't do when we're connected for life.
We are all here today because we care about health and wellness, our own health, the health of our community, the health of our families, friends, and employees. As business and community leaders, we must tackle workplace wellness and chronic health concerns head on. The mission of the American Diabetes Association is to improve the lives of people affected by diabetes and to find a cure for this serious and potentially life-threatening disease. ADA represents those with type 1, type 2, gestational, and pre-diabetes, as well as their loved ones and their support systems. Since 2020, the pandemic has shed a spotlight on critical concerns around health equity and access to care for our most vulnerable populations. The association has a renewed focus on chronic disease prevention, as well as access to quality health care, nutritious foods, medications, and diabetes management for all. I'm now pleased to introduce Anthony Wilson, Director with MMT Ambulance Services, Co-Chair of the Virginia American Diabetes Association Leadership Board, and National Ambassador for the Diabetes and Heart Association's No Diabetes by Heart initiative, to share more about today's program. Anthony?
How do I follow that? I think she's an expert. It's natural. Again, welcome. Thank you, everybody. Diabetes continues to be an epidemic and one of our nation's greatest health challenges. Currently, there's 37 million Americans that have diabetes and another 96 million that have prediabetes. So that's 1 in every 2. Look around the room. When we're kids, count off. 1, 2, 1, 2. And that's half this room are living either with prediabetes or with diabetes, and you have no idea. In Virginia alone, more than 700,000 people, which is approximately 10% of the population, have been diagnosed with diabetes. The economic cost of this diagnosis is approximately $8.4 billion. 8.4. That's a lot of money spent in healthcare in just Virginia alone. It's estimated that 1 in every healthcare dollars is spent treating diabetes and its complications. And this does not account for absenteeism or loss of productivity in the workplace. That's a lot of money too. It's a whole lot. And again, we take for granted, the comorbidities involved with living with diabetes and how much people really lose time at work from loss of productivity. While this may seem like a bigger picture than any other to this room can tackle, we know that there's hope. While we all have a role to play in the collective health, studies have shown that the leaders can bring focus to wellness by creating a positive work culture. We have some amazing leaders here in attendance today who will share their stories and a passion for this cause and for our community. I'd like to turn it back over to the expert, Marilena, to introduce the keynote speaker. Thanks, Marilena. I'm just trying.
Thank you, Anthony. You did a great job. Also natural. Thank you. Thank you, Anthony, also for your commitment to the association and to improving the health of our Hampton Roads community. At this time, I am pleased to welcome our keynote speaker for today's program, Dr. Michael Charles, Executive Medical Director for Sentara Community Care Program, a new delivery model to help care for the uninsured and underserved people across Virginia. Dr. Charles earned his medical degree from the Medical College of Virginia in Richmond after completing his bachelor's degree in biology at Grove City College in Grove City, Pennsylvania. Dr. Charles spent 1 year in a general surgery internship at the University of Medicine and Dentistry of New Jersey in Newark, New Jersey, and completed his residency in family medicine at Portsmouth Family Medicine in 1994. He is certified by the American Board of Family Medicine and is a fellow of the American Academy of Family Physicians. Dr. Charles joined Sentara Medical Group in 1994. He's practiced family medicine in Virginia Beach for 30 years. Dr. Charles has been a member of the Sentara Medical Group Board of Directors and the leader of their quality committee. He's an assistant professor of community medicine at EVMS. In 2013, Dr. Charles was appointed as Sentara Medical Group's medical director for clinical effectiveness. 2 years later, also became the medical director for quality at the Sentara Quality Care Network. In these roles, he's been able to focus on his interest in quality patient care and population management, and in 2022 assumed his current role. He is the published author of the book Bob and the Afterland. Dr. Charles is married to Kelly and has 3 children, Ryan, Caroline, and Jack. Dr. Charles?
Thank you. You make me sound a lot more interesting than I think I really am. Dee Dee asked me to talk a little bit about our community care program, and I'm going to roll this into diabetes, give you a little bit of some of our data too here. So during COVID, we found there were a lot of health disparities, that there were a lot of issues getting information out to certain populations. There was a lot of trust issues. And as a result of that, outcomes for certain populations with COVID were not good. And vaccine rates were also not good. Again, part of the trust issues, there was communication needed, and there was a lot of outreach we did with that. And one thing I realized when we were doing all that, it was not just COVID. These same populations had poor diabetes outcomes. They have higher mortality rates, higher hospitalization rates, ED utilization. And when you started looking at some of these neighborhoods, you realize that they don't have healthcare access like other regions do. And that's how Sentara Community Care was born. And we've expanded now. We first started in Norfolk. Our first practice was in Berkeley. We have vans now across the Hampton Roads area, and we're all the way out to Harrisonburg, Richmond, Petersburg, Northern Virginia with expansion. So if you go to the next slide, I'm just going to go through fairly quickly here. One of the reasons, and I think this was alluded to a little bit earlier today, is the whole health and well-being of our population. It's not just me taking care of their sugars and their blood pressure control and their health issues. It's their social economic factors, their physical environment, their healthy behaviors. So much of that's 80% of a person's health and well-being. And unless we address that part of it, we're not going to do a good job with that last 20%. Okay. Next slide, please. So with Sentara, and again, I work with Sentara, but to their credit, they realize this. This is not a money-making project, right? But they've put, they've supported this, and why we can do this is because we're an integrated health system. On the left, this is our, classic health system, the doctors, the hospitals. The middle is our insurance company arm, which helps fund this. And then Sentara Cares, which is our foundation that does support organizations like the ADA and food banks. We're partnering with a lot of those organizations. Community care brings kind of all these together. Next slide. So again, I alluded a little bit to this with the mobile van. We're putting brick and mortar sites, but we put them in areas that really don't have a lot of health care. That's where we're looking for to bridge that gap. The vans also go to areas that don't have traditional health care or missing some opportunities there. And the third one here, I'll come back to a little bit later, is actually embedded clinic. We embedded a clinic in the Union Mission homeless shelter in Norfolk, and I'll talk a little more about that. Next slide. So again, when we're looking at this is different from a traditional health, center or medical practice. We have that on the left. We do have that primary care. We have nurse practitioners. We have associate medical directors as physicians, and we do have behavioral health services, which are needed in these areas too. But the other side is kind of where we're a little bit more unique. We have the wraparound services. So we look at the social drivers of health too. When the patients come in, we have questionnaires. We ask, do you have transportation? Do you have food? Can you afford to buy that medication when I write that prescription? Because this is the challenges we're dealing with. I can write a prescription for that patient. Well, one, they don't have any transportation to get to the pharmacy to pick it up. Two, when they get there, there's a copay they can't afford. So there's a lot of challenges besides just writing that prescription. And we ask these patients and we help them. We have community health workers in all of our practices, on our vans, at the Union Mission. And their total job is to help with the social drivers, to help with these outside issues, these social issues that really affect our health and well-being. And then the community partner support. We reach out, so we partner with faith-based organizations in our communities. They have been an incredible help for us, telling us where the needs are. And again, that's where we try and help to build that trust. There's a lot of trust issues in communities, and unless you can bridge those gaps and really show that, we do want to help, but that you have to build that trust. It doesn't happen overnight. And partnering with civic leaders, at the Civic League in Berkeley we go to and work with them, but also, again, faith-based leaders across the state in our different regions have been incredibly helpful for us. Then, of course, Food Bank, we do have addiction medicine support at our practices too. Next slide. So this is one heat map here. We've looked at a whole bunch of, yes, where are we going? Why are we in some of these areas? Well, we look at heat maps like this. This heat map looks at Medicaid populations, but we basically overlap a lot of different heat maps. And the other ones, we look at diabetes control. We look at hypertension control. We look at hospitalizations. We look at mortality rates. And they're all the same. These red areas are high mortality rates, poor diabetes control, poor blood pressure control, high ED utilization, and low access to healthcare. There's FQHCs in some of these areas, but they can see as many patients, but they get overwhelmed. So there's need for this. And again, that's why one of our first practices in Berkeley, and our van goes right to downtown Norfolk here. Next slide. So Dee asked me to talk a little bit about diabetes. The population that we're serving, I'd like to say almost everybody has diabetes, but it's really close. So diabetes is something we deal with on a day-to-day basis. This is our scorecard for all of Centera. All of Centera. So this looks at our regular practices, not just community care practices. And just real quick to the top, and we follow a HEDIS measure, which is a nationally benchmarked measure, and this is an A1C less than 8. Obviously, our goal is lower than 8 for everybody that knows diabetes, but this is a national benchmark. And that's 66.7%. Ours is up to 71.6%. So across the system, we are performing well. But in the middle, you can see we also look by region. So we're looking a whole across the state at our different regions. We can see certain areas that need some extra support, some extra help. And then at the bottom here is our health equity dashboard. So we break this down into race and ethnicity too. And if you look at the system goal is kind of that orangish line there, and we're actually doing, the system goal is actually the national benchmark. So we're doing fairly well, but what this does point out is there can be certain communities, certain cultures and races or ethnicities that need some extra help. Hypertension, for example, is a huge one in the Black population. It's a focus that we're working on right now. Diabetes, of course, as you all know, is another focus. Next slide. So again, why we do this, I think you all have seen the difference between equality and equity. I like this slide because I like the liberation, you know. You can get different size boxes. You've probably all seen the bicycles that are different, or the apple tree. There's a whole bunch of different ways of looking at it. But let's remove the fence completely, so we don't have to worry about different box sizes. Remove those barriers, and by supplying healthcare in these regions, bringing the healthcare to these populations and these communities really is what can make a difference there. Next slide. I'm almost done. This is where I told you I'd come back to the Union Mission. So this is one of the first patients I saw at the Union Mission homeless shelter, and I looked through Epic. This is our EMR. This is screenshots from our electronic medical record. This is this patient's visits for his health care. Every visit is an ED visit here. No primary care visits. And there were 164 emergency room visits over the past 15 years for this patient. So that's where he's getting his health care. And he had diabetes. Okay. So by seeing him in the Union Mission, we became his primary care physician, and we were able to break this cycle of ED visits. But it's not just Union Mission, it's down at Berkeley too. It's, you know, in other neighborhoods, you all know the neighborhoods, they are getting their care at the emergency room. And the emergency room does a great job. They do what they can, but it just doesn't work. Next slide. So where we're going next? Again, we've already, Richmond and Petersburg, a huge area of need. Harrisonburg, we have, usually every area we have a little brick and mortar, and we have a mobile van there too. Newport News, we have a collaborative clinic building coming there in downtown Newport News. Henrico County, and in Halifax, Danville, and Roanoke, we're looking over the next 2 years. So with that, that's just kind of a quick overview, and if there's any questions, I'll be happy to take them. Thank you.
Thank you. Dr. Charles, thank you for speaking with us, sharing your insight and expertise. Obviously, community health is so important. We appreciate the work that you are doing. Sentara Health is in its third year as the statewide funding partner for the American Diabetes Association's Power Project initiative. So this program is designed to change the trajectory of obesity and type 2 diabetes in our young people, as well as to help adults living with diabetes to better manage the disease to prevent future complications. Both programs use evidence-based curriculum focused on healthy eating, physical activity, and family and community engagement. We would also like to recognize Arlene Sadoff, Sentara Health's Director of Talent Acquisition and a key ADA volunteer, and ask her to come forward to receive a recognition award. We are also excited to have Dr. David Lieb with us today. Dr. Lieb serves on ADA's Virginia Leadership Board and is a respected endocrinologist, professor, and researcher at Eastern Virginia Medical School and the Strelitz Diabetes Center. So Dr. Lieb, I'm going to turn it over to you to talk about the Western Tidewater United Project.
Thank you very much. Thank you. And thank you, everybody. Dr. Charles, that was fantastic. Thank you. And thank you to Anthony and Sheila Wilson and Deanie Eldridge for providing me an opportunity to talk a little bit about EVMS and what we're doing with respect to diabetes. So for those who may not know me, I'm an endocrinologist at Eastern Virginia Medical School. I've been at EVMS since about 2009. And I have the privilege of serving as the Vice Chair for Education in the Department of Internal Medicine and also the Fellowship Director for our Endocrinology Fellowship Program. So it's incredibly rewarding work with respect to training the next generation physicians that are going on to be endocrinologists and teaching them about diabetes prevention and diabetes management. I'm proud to share that EVMS and the Strelitz Diabetes Center have been actively involved in the Western Tidewater community for the last 15 years. The data that we looked at was pretty worrisome and concerning for some of the parts that are a little bit closer to where we are right now. But Western Tidewater, Virginia, also has significant problems with respect to diabetes prevalence and management and access to care issues, like Dr. Charles mentioned. We've also been fortunate to be involved in screenings and provide clinical care, fostering close relationships with organizations like Sentara Healthcare, particularly at Sentara OBC Hospital, where we used to have a clinical program. Our work in Western Tidewater is focused on their alarming prevalence rates of diabetes, rates that surpass both the state and national average. I think that's the theme here. More than just Western Tidewater, but our whole region, the prevalence of diabetes surpasses that the rest of the state. And through extensive screenings over the last 2 years, funded by a multi-year grant from the Dean's Office at EVMS, we've screened almost 300 individuals for diabetes at various events, including health fairs, businesses, religious institutions. And I'm very fortunate to be joined today by Abby McMillan, who was our health educator and coordinator for the Western Tidewater Project. So I think many of you have met Abby at screenings throughout the Western Tidewater region and probably some other places outside of Western Tidewater too. Very similar to the data that Anthony presented at the beginning, about half of the people that we screen have either diabetes or prediabetes. And it's important to remember that a significant number of those individuals with prediabetes are going to go on to develop diabetes and are already at risk for heart disease, which is really the biggest thing that takes the life of people with diabetes. So as we dive into the data analysis, we're interested in understanding the factors associated with developing diabetes in this population. We're exploring known factors that are associated, such as family history and obesity. And we're delving deeper into the social determinants of health, many of which Dr. Charles mentioned, examining how access to healthy food, healthcare, and transportation impacts not only diabetes control, but also the likelihood of developing diabetes-related complications like kidney disease, nerve disease, and heart disease. It's interesting. Western Tidewater is a little different than other parts of Hampton Roads in that it's a very rural population. And there are a lot of issues with respect to rural care, certainly that came up during COVID, but that continue to persist now, especially with respect to access to care. In our commitment to improving healthcare outcomes, we're in the process of developing a study focused on folks living in Western Tidewater who frequently use the emergency room, similar to the poor gentleman that was at the Union Mission, or folks that are frequently hospitalized. And our aim is to understand how we can reduce high healthcare usage, specifically in a rural population. As somebody living with type 1 diabetes, I want to take a moment to express my deep appreciation for the unwavering support of everybody in the room today and the broader community. This is a pretty special group. From a professional standpoint, some of my greatest happiness comes from the folks that I get to meet in the networking that I do at events like this. So it means a great deal to me personally, and certainly also to EVMS and the Strelitz Diabetes Center. And special thanks to Sentara Healthcare and also the American Diabetes Association for their collaboration and support. Together, we can make a significant impact on diabetes awareness and ultimately the health and well-being of Western Tidewater residents and really all of Hampton Roads. With that, I do want to make one more announcement that I promised the people at my table I would make. If you parked on the street and you weren't able to pay the meter because they don't start until 9, it's 9. So log into your Park Norfolk app and pay for the hour so that you don't get a ticket. That's it. Deanie, thank you very much. Thank you.
Don't go too far, Dr. Lee, but Dr. Charles, if you could come up here as well. We do have two things on behalf of the association for you both. And we appreciate the practical advice too, you know, the health advice and the parking advice, all good stuff. We'll have you do it.
Yes. 1, 2, 3. All right, Anthony, your turn.
Thank you both so much. We appreciate the insight, the expertise, and everything that you've shared with us today. So now we would also like to recognize other ADA healthcare system partners in attendance today. They're also doing great work in the population health space. So thank you to Bon Secours Health System, represented today by Maryview President Shane Neasley, Marilyn Crandall, and Felita Bolden. And Riverside Health System, represented by Kimberly Denny. We appreciate your contributions to the ADA and to our community. We are now pleased to recognize 2 longtime community partners who have not only supported the American Diabetes Association, but have also made their mark prioritizing the wellness of their employees and making a difference for numerous organizations and individuals across Hampton Roads. I am first excited to recognize my own employer, Wavy TV 10 and Fox 43, for 10 years of partnership with the American Diabetes Association. Going to invite Carol Ward, our Vice President and General Manager, to come forward, accept the award, and say a few words. Carol? Do you want a picture for me?
Picture first, or oh no, go ahead. I'll get it at the end.
Thank you so much. Was quite a surprise. I'm a diabetic of 40 years, type 1, and I just celebrated it last month. And I do celebrate it because, you know, I'm still here kicking, as I tell everybody in the station. They'll be like, "How you doing?" I said, "I'm still kicking." It's a disease that affects everything, and it's frustrating, very much so at times, because you're doing everything right, and you're like, why are my numbers off, or whatever. But the advances have been amazing. Every state I've lived in, I've lived here for almost 11 years now, I have been part of the ADA or the JDRF, whichever one in that market was the one that drove everything. I've never seen a group, where are you all? I know you're right there, everything, that is so good. You guys do such great work, and the impact is really, really felt all over. So congratulations to you guys, really. And I don't have red, sorry.
They still look fabulous, Carol. 1, 2, 3. Thank you.
Our next legacy award goes to Max Media, which has supported ADA and its annual Tour de Cure event for more than 20 years. In addition, Max Media is proud of their 30-plus year relationship with St. Jude Children's Research Hospital, which has resulted in $6 million raised for children's cancer research during that time. We welcome Keith Barton, Vice President and General Manager, and Tone Hollywood, radio personality with 100.5 The Vibe. Once Keith has accepted the award, we'll ask Tone to spend a few minutes sharing his story. Congratulations.
Before I get started, I want to just let you know, Tone was the fastest human being in the United States at one point. Maybe he'll talk about that. Yeah, I got involved with ADA. My best man was diagnosed with diabetes when he was 12, I believe, and he passed at 33. So Deanie and Pat Schuler, who was part of the board at one point, sucked me. It wasn't hard. It wasn't a hard decision, and we're glad to have Amy back too, because she had taken a brief respite from ADA. But anything to do with kids, anybody who knows me, I'm done. Any kind of support we can give, and then through Max Media, I've been able to extend certain things in the community, and largely because of Jeff's father. He was one of the owners of Max Media, and I asked for us to be able to get involved and share our our airtime, and it was an immediate yes. So ever since then, we've been involved, and I'm very happy to be involved. So, Tone Hollywood, fastest man here.
I'll try to make this quick. Good morning, everybody. First of all, good morning. How's everybody doing? Great. My name is Tone Hollywood. I'm actually originally from Hampton, Virginia, right here. And just to give you a quick brief story, radio personality of 21 years. And while I was doing radio in South Carolina, we were really involved in the American Diabetes Association. Went to the walks, helped promote any event they had coming up. and was always being supportive as a personality to make sure we got the word out to our community and stuff. And then 2014 hit. And then in 2014, while I was at a wrestling event, WWE Raw, I took a good friend of mine's brother to the event, and I just was uncomfortable. You know, I kept going to the restroom. I noticed when I was on the air earlier that day, my vision seemed a little bit blurry, and I remember telling my co-host, I was like, "Is that blurry to you?" She was like, "No." I was like, "Oh, okay." So as I'm at the wrestling match and I'm going back and forth to the restroom, I said, you know what, something just seems off. So I went ahead and made a call to my doctor, and we had a really good rapport. She invited me to come on in the next day, and I went in for my diagnosis and found out at that moment that I'm type 2 diabetic. And then everything shifted as far as my support, as far as my concern about my body and concern for others. It just all sudden changed. And I want to say thank you to the American Diabetes Association for some of the great things that they provide. I mean, I got a chance to go to nutrition classes for free. I got a chance to go to be educated about the disease. I got a chance to sit with other people who are diabetic, type 1 and type 2, and kind of learn about the lifestyle changes. I even had an accountability partner who snuck up on me one day when I was at the Waffle House. I mean, I don't know if any of you when you were younger snuck out the house and then got caught, but that's exactly what it felt like. Like, I was hungry. I already knew what I was going to get. I was going to get an American special, you know what I'm saying? Waffles, sausage, egg, and cheese, grits with sweet tea, and was ready. And I opened up the door, and all of a sudden, my accountability partner walked in. I said, "Are you kidding me?" She's like, "What's your blood sugar look like?" I said, "You know what? Don't even ask." So I left. But those are some of the great things. I'm not sure it's going to be that extreme, but those are some of the great things that the American Diabetes Association provides, of course, with the Tour de Cure that's coming up this spring. And I challenge you to challenge your friends, as I'm going to do the same, to challenge some of my friends and to partner up to get a team so we can all go ahead and ride together and ride diabetes out of our system, reverse diabetes in our communities. And also, I'd just like to say thank you to Amy. Amy, I've known her since the 5th grade. Yeah. I've known her since the 5th grade. So when I moved back here and found out that she was running this program and stuff, I was like, oh, this is perfect. The perfect person, because not only is she got the great personality for it, but she'll beat you up if you don't do what she says. I mean, I was in the 7th grade, she stuffed me in a locker. You know what I'm saying? So that's you think I was gonna tell you something? Yeah, no. But seriously, I want to say thank you to everybody in the room. Thank you, Dr. Charles. Thank you, Dr. Day. I really appreciate what you guys do. And if there's any way that Max Media at 100.5 if I can help, please let us know. Thank you to Channel 10. I've seen a lot of things that you guys have done. Carol, we need to talk again, you know what I'm saying? Because I would love to help out and collaborate with some things. And just want to say thank you for having me here this morning. And let's just reverse diabetes here in the 757. Thank you.
All righty. Thank you all. Storm.
I think it died on us.
I think we're back.
Okay.
There we go. Thank you all for sharing your stories and those remarks with us. At this time now, I would like to welcome Sheila and Anthony Wilson, ADA Leadership Board co-chairs, to the podium to talk about some of the tools, resources, and opportunities available to you and your organization.
What kind of clap was that?
There's always one. Oh, gosh. Good morning.
Good morning.
All right. Thank you, everyone. We appreciate you making this breakfast a priority today. It speaks to your commitment to empower your employees, colleagues, community, and yourself to better health. Here in Hampton Roads and around the country, the American Diabetes Association leads the way against the deadly consequences of diabetes and fights for those affected by this disease. We fund research to prevent, cure, and manage diabetes. We deliver services to hundreds of communities. We provide objective and credible information, and we give voice to those denied their rights because of diabetes. In your folder, everyone should have got a folder when they came in, you'll find a wide array of materials and resources, including information on the ADA's Type 2 risk test and community resources, complimentary, I cannot talk, year-long Living with Type 2 Diabetes program, Diabetes Food Hub, nutrition and healthy eating site. If you have not been to that site, it's pretty amazing. ADA's Project Power Youth program, which was mentioned earlier. At the national level, the association offers many resources to individuals across the country, including the diabetes.org website and our 1-800-Diabetes Center for information. These services are free for charge, thanks to generous local and national donors. Over to you, because I know you like to talk.
I really don't like to talk, but Dee Dee put me on the spot. You know, you heard what Keith said earlier? You kind of show up for an event, and then all of a sudden, they get you. They put them claws in you, and you can't leave. You know, but we all do it because we appreciate it, and we're all doing it for a great cause. So take a moment again to review the information when you get back to the office with your staff and your HR and wellness.
You don't need a mic.
I think it's dead. Can you hear?
Yeah.
All right. Well, it's red, so it's probably going to stop. So I'll just keep talking. Introduce a type 2 diabetes risk test at your workplace, and contact your ADA staff or the team or any one of us up here, you know, if you need any assistance. We also like for you to join. We also like you to join our 2024 Tour de Cure in Smithfield. I'm hoping everybody's got a team. If you don't,
Here we go.
if you don't, I'm just going to say it. If you don't, Team Wilson is always available. You know, we're taking, you know, it doesn't matter. Just show up. But again, it's April 27, 2024. We had a great time last year, great experience. You know, typically I'm going to pause for a second. Arlene, will you come up real quick?
Sure.
Because I just want her to tell you just a few minutes about Tour de Cure.
Sure. Good. Okay. Hello, everyone. I'm the committee chair, Chair Ollie here. What do you call Ollie?
Come on, Ollie, come on up here.
I'm gonna make it
He was sitting beside Sheila and I didn't see him, you know, so.
I work for Centennial Healthcare. I'm also a volunteer for ADA for about 15 years. And everybody said it right. They're so sweet. They're pretty lady this, and you're so organized that. Come on, you can do this. But it's so much fun. This is such a great family. And the tour is wonderful. It's an all-day event. We need volunteers. We need riders. We need support ahead of time. We need people to raise money. We had a great tour last year. We raised around $500,000. Fantastic event that you would all love to join as your friends and family. Anybody can ride 10 miles. I can ride 10 miles. And if you can't ride, you can volunteer. There's so much work to do for such a good cause. So please come out and join us. Email me, call these ladies that'll tell you nice things about yourself. And make you feel good.
Thank you. I got it, what's going on?
I think she covered it all. We do have a goal though, so currently we have 108 participants that signed up. We are looking to get 200 by the end of the month, so help us reach that goal. We would really appreciate it, and thank you all for doing that today.
Oh, I forgot. Centennial Healthcare also has a team. Ollie has a team. You can join any of our teams.
Go sit down now. We'll talk about enough's enough. So Jim, would you like to show the video from? Oh. Y'all ready? You know that last picture where you saw her pouring that? That was non-alcoholic, just to let you guys know. So, Jim, thanks for that. Great video, Jim. So again, as you can see, it's a great team builder. It's a great fundraiser, and also, assist us with the ADA's mission. So again, I'm looking forward to seeing everybody in April, maybe sooner, as we do some test rides. And are you guys looking for any more people for the committee, for the touring committee? So if you're interested in participating on the committee, to bring some value and input, please contact Arlene or Ollie or one of the staff members, and we'll make sure you guys get signed up as well. At this time, I'm pleased to also recognize our national ADA partners, and that would be, you ready? Look at them. They just look out. Just smile. It's coming to you. Smile. So it's ADA Project Power, and the ADA's month initiative is going to be CVS Health, and that's going to be represented today by Josh Eckhart and Jay Jones. Welcome, and thank both of you for your engagement and agreement. And they have already told me that CVS is coming with a team, or 2 or 3 or 4 or 5. So they won't join Team Wilson, but we got a battle. But again, thank you guys both. Welcome. We appreciate your support. You want to stand up real quick just so people can see you?
Thank you for having us.
Yeah. Now, I would also like for all of the ADA leadership and volunteers to please stand to be recognized. Who we got? Reno? Thank you. We couldn't do the things we do without volunteers. And again, Sheila and I both appreciate each and every one of you for all you do day in and day out. I'd also like to recognize Jeff Saunders. Jeff, will you stand up, please? So Jeff missed our last meeting, but Jeff raised over $50,000 last year, or this year. Come on up, Jeff. Normally I don't do this either, but come on up, Jeff.
You just want to give me a hug?
Yeah, and I want you to say a couple words about why. Why?
A lot of you have heard the story before. My mom, prior to passing away, was a 50-year diabetic, also a late onset. She developed diabetes at 34 years old. And growing up as a typical kid, well, probably not typical, but but growing up with a mom with diabetes, I never realized a lot about the disease and what it did to people. I knew my mom had it, and I knew there was issues around it, but I never, like I said, as a kid, took the time to really understand it. And then, lo and behold, at 49, very similar story to Tone. Wasn't feeling good. Going to the bathroom at a meeting, someone actually called me out and asked me how many times I was going to go to the restroom. I actually had the same exact thing where I couldn't see the board, and I asked the person next to me, was that blurry or is it me? And I called my doctor that day and went the next day, and unfortunately found out it was blood work on a Friday, and Saturday morning I didn't feel well. And I called my doctor and I said, look, I really feel bad. And he goes, hey, just do me a favor, just pull out that blood test kit when we thought you were a type 2 diabetic. And they had thought I was type 2, and I had gotten in really good shape and lost weight and taken it serious. And I hadn't checked my blood in quite some time, and lo and behold, I checked my blood sugar, and it's 670 something. And he goes, who's home with you? I said, my wife. He goes, I want you to meet me at the emergency room. And my brother-in-law, who's a retina surgeon, comes over out of nowhere, and I was upset, so I handed him the phone, and he knew my doctor. I said, Jeff's not going to do well at the emergency room. Is there anything we can do? And he's like, look, I can prescribe some insulin, and you'll promise you'll go up to CVS with him and grab it. And we did that, and my first needle was bent in my belly because neither one of us knew what we were doing. But I will tell you that about 2 hours after that, I felt better than I had probably felt in 2 years. And I've been dealing with it ever since. And my big play on this, and I guess what I'm leading up to, is that I want to promote advocacy and knowledge about the disease, because as someone who grew up with a mother with type 1 diabetes and didn't understand it, I wanted to make a difference to other people so
that other people around us understand it, not only to help those that have diabetes, but those pre-diabetics and those that eventually will get it, because as Dr. Carls and Dr. Lee said, as Anthony said earlier in his talk, over half the Americans have it. So something that was near and dear to my heart that I could contribute back to. So thank you guys. Appreciate it.
All right, Monica Lee, I'm gonna turn it back over to you to close us out. I wanna thank you for coming and supporting. Hopefully we'll see you at Twitter Pure Live.
Yeah.
Don't y'all wanna see her? All right. We wanna present you with this fall. Is she ready?
We're ready. Margaret, we're torn. 1, 2, 3. Great.
Thank you all so much. I'm just so inspired by seeing all of the amazing things that everybody in this room is doing, so motivated. So this is just so incredible. Thank you for having me. And thanks to all of you for coming out here this morning. We know everybody has very, very busy schedules and a lot going on this time of year especially, so we don't take your participation lightly. Thank you so much for investing your time in us. The American Diabetes Association would like to invest in you too. And I hope everybody takes what they learned today and find ways to kind of leverage that in the culture of your organization, as so many people that we've heard from today have done. Now is the time to find new, innovative ways to champion the health and the well-being of your employees. This is American Diabetes Month, so please, you can find additional workplace materials at diabetes.org/ADM. You can find information there. We also would like to close out the program with our 2023 anthem video.
November is American Diabetes Month, but we're not here to celebrate it. Not when diabetes is gripping us and hurting us. At the American Diabetes Association, we're here to make a stand. Join us, add your passion, lift up your loved ones and those in need, and move us closer to a cure. Someday, we can celebrate. Until then, we fight.
As the video says, we will fight to make a stand. Someday, we'll celebrate, but until then, we will fight for those who are living with diabetes. Thank you again so much for everyone for all of the work that you do in this community. Thank you for attending, and enjoy the rest of your day.